This resource is being made available by the experts at Senior American Insurance Agency. You can visit our educational website at 65medicareinfo.com, and we can call our toll-free number at 800-332-7557, Monday through Friday, 8 a.m. to 3:30 p.m. Eastern Standard. Thanks for tuning in today, and today we're going to be on the subject of Medicare Advantage. What is it? How do you enroll in one? Etc. This is the informational video that you're going to want to watch if you're interested in Medicare Advantage. Okay, Medicare Advantage, what is it? How do you get it? There's a lot of questions about that particular subject. This video is going to focus on the fact that there's two different ways to get your Medicare, and Medicare Advantage is obviously one of those popular choices. Why is it popular? We're going to discuss the types of Medicare Advantage plans that you can enroll in, the items to consider when you're looking at Medicare Advantage plans, what time periods do you have to make those choices, and where to look for extra help. If you haven't watched our video, The 2 Ways to Get Your Medicare, I suggest that you actually stop and go watch that video first, because that will give you a more rounded understanding of the subject. But for right now, we'll just break it down. Medicare fundamentally says that there's two different ways that you can get your benefits from the Medicare program, either Original Medicare or Medicare Advantage. If you decide to go Original Medicare, that consists of Part A benefits the hospital, Part B benefits the medical. You can have an optional Part D, prescription drug coverage, and you can have an optional supplemental policy. Whether that supplemental policy is a standalone Medicare supplement policy, it could be group insurance, or it could even be military related like TRICARE. Medicare Advantage plans are administered by private insurance companies. They're approved by Medicare, but they're administered by private companies. Simply put, Medicare Advantage plans wrap the Part A hospital, the Part B medical, and in many cases the Part D prescription drug benefits in a plan that's administered by a private insurance company. These plans are approved by Medicare, and they have to follow the Medicare guidelines. That's just a brief understanding. Again, if you haven't watched the 2 Ways to Get Your Medicare video, that'll give you a more rounded understanding. This will be a very quick understanding, and we're going to focus this video on Medicare Advantage. If you've watched our other videos on the 2 Ways to Get Your Medicare, you may have seen this chart. We're just going to go through it again really quick to make sure that you understand the difference between Original Medicare and Medicare Advantage. The fundamental difference is how the claims are processed. If you go to a doctor or have a hospital expense under Original Medicare, they bill either Part A if it's a hospital bill or Part B if it's a medical bill. Medicare pays their portion that they agree to cover. Technically, you're responsible for what's left over. That's why people purchase Medicare supplemental policies. If you have one of those, they would pay on the claim after Medicare pays on the claim. So you have two insurances paying on the same claim. And then if you want drug coverage, you buy a separate Part D plan. If you're in a Medicare Advantage plan, if you go to a doctor or have a hospital expense, A and B of Medicare is still there. It doesn't disappear, but the doctors don't bill A and B Medicare. The doctors and hospitals bill the Medicare Advantage plan, the ones that are doing the administration. The Medicare Advantage plans pay back to the doctors and hospitals the portion that they agree to cover, and then you would pay any out-of-pocket expense that's determined by the Medicare Advantage plan. These companies get paid by Medicare to do the administration. Where that money comes from is the money that you pay into Medicare through your Part B premiums. So that's, again, just a fundamental look at the difference between how the two work as far as the fundamentals of claims. With Original Medicare, the doctors bill, or A and B Medicare, they bill the Medicare program directly. With Medicare Advantage, the doctors and hospitals bill the Medicare Advantage plan directly. So I hope that clears up a little bit of your understanding on Medicare Advantage and Original Medicare, how these claims work as far as the fundamentals of the claim. Why would somebody choose a Medicare Advantage plans? Well, there's several different reasons why people would make those choices. Medicare Advantage plans are, as we discussed, administered by private insurance companies, And because they're administered by private insurance companies, you can also have a private insurance agent that gives you service. So that agent can provide service on claims, on prescription drugs, anything that you need assistance for. You can have a person there to help. That's important. Many of these plans obviously offer a neat package: doctor benefits, hospital benefits, and drug benefits all in one card. So you just show your card and it all goes billed through the plan. They can provide additional benefits because these plans get paid money by Medicare to do administration. They can spend that money on things like hearing benefits and dental benefits that Medicare does not even cover. That makes them attractive. Monthly premiums. Medicare supplement policy rates can be on the high side. Medicare Advantage plans in some states and counties are as low as zero. That makes them obviously attractive premium-wise. And because of the fact that there's no pre-existing conditions, you can always change plans from one year to the next and not have to worry about whether the pre-existing conditions will be covered. They will be covered by the next plan because you had coverage in the prior year. So because the Medicare Advantage plans do offer different levels of out-of-pocket expenses, that makes them attractive because you can always change to, let's say, a more comprehensive plan down the road. In just a moment, we're going to take a look at the types of Medicare Advantage plans. Medicare Advantage plans typically have four formats in which they're operated. First of all, an HMO, or a health maintenance organization. HMOs typically have contracted doctors and hospitals, and they ask you to go to those contracted doctors and hospitals. Many of the HMOs do a very good job at coordinating your care between your primary care physician and different specialists that you might have to go to. PPOs are preferred provider organizations. They also have contracted doctors and hospitals. In a PPO, if you go to one of the contracted physicians, you typically pay a lower out-of-pocket expense than if you use a non-contracted or an out-of-network provider. So the benefit to a PPO is the fact that it allows you to use other doctors outside of the PPO network. Private fee-for-service plans are considered to be the least restrictive. You can use any doctor in any hospital in the United States as long as that doctor and hospital is willing to accept the plan's terms and conditions. Special needs plans are really designed for specific people groups, and there's generally enrollment criteria that you need to meet in order to join those types of special needs plans. Two of the common plans are people that have Medicare and state medical assistance, also known as Medicaid, and people that have chronic health conditions like heart disease and diabetes. So those are just some of the different types of Medicare Advantage plans. It doesn't matter which one you join. They just offer different formats in which you might receive your healthcare needs. In order to join a Medicare Advantage plan, there has to be something called an election period, and we're going to look at four common election periods in Medicare. The first is the initial election period. This is when you're turning 65 and getting Medicare for the first time. You have the 3 months before your 65th birthday, the month of your 65th birthday, and 3 months after. So anytime during that 7-month period, you can join a Medicare Advantage plan. During the annual election period, this happens every year between October 15th to December 7th, and during that time you can make changes to your Medicare any way that you see fit with either Medicare Advantage or Original Medicare and Part D plans. There's many different special election periods. They can be used anytime during the year if you qualify for a special election period. People that have low-income subsidy, if you get extra help from Social Security, if you have a state pharmaceutical assistance program, if you have Medicaid, if you move out of the service area, there's many different types of special election periods, and they can generally be used anytime. The annual disenrollment period for Medicare is between January 1st to February 15th. During that time, it allows you to leave a Medicare Advantage plan and go back to Original Medicare. It does not allow you to go from Original Medicare into a Medicare Advantage plan, only the other way around. You can leave a Medicare Advantage plan and go back to Original Medicare, and if you'd like, you can also pick up a Part D. So those are some of the common election periods that you can use to join a Medicare Advantage plan. We've already discussed why Medicare Advantage plans are attractive, and these are some of the things that you might want to consider if you're considering joining a Medicare Advantage plan. Low monthly premiums. If you don't want to spend a lot of money in monthly premium and you're willing to pay some out-of-pocket expenses as you use the services, that's a great way to go. Obviously, as we discussed, you can get all your Part A hospital, Part B medical, and Part D drug benefits all in one plan, so you have one convenient card to use for all your healthcare needs. You can get coordinated care by using doctors within the network if you join a HMO or a PPO. You can get additional benefits from some of the Medicare Advantage plans that original Medicare does not provide. And you can change to a different plan every year. I think that's probably one of the most important things, is the fact that you can adjust your Medicare Advantage plan to the healthcare services and the health conditions that you now have. And every year you can make those determinations if you want to get to a more comprehensive plan that maybe charges a little bit more, but you have lower out-of-pocket expenses, or even change to a Medicare supplement policy. Because you can make those changes every year, it gives you the opportunity to adjust, and that's important. So those are some of the things to consider if you're considering joining a Medicare Advantage plan. We've given you some of the fundamentals today on Medicare Advantage. We hope this helps your education on the subject. We ask you that you would continue to use our website, 65medicareinfo.com, to continue your education on this subject. We'd ask that you attend one of our online webinars. This is a great format that you can join in with other people. You can ask questions about your situation. Other people might ask questions that are similar to the questions that you have. So it gives you a more rounded view of the subject. You can meet one of our online representatives for one-on-one help. If you want to have a health coach, we're willing to do that too. We're willing to walk you individually through your individual circumstances and help you find a plan that fits your specific needs. If you just want to call us for a quote, feel free to do that. 800-332-7557, 8 a.m. to 3:30 Eastern Standard every business day. We're there. You just give us a call. We'll give you a quote. You can email us for a quote or ask specific questions about your situation. Quote at 65medicareinfo.com. We'd ask that you continue to look over our website, specifically the Medicare Decision Formula. If you can simplify it to decide which form of Medicare you want to get, find a plan that fits your healthcare needs, your lifestyle, and your budget, you'll be all set on how to make a decision on your Medicare. We're there to help. Give us a call, email us for help. Thanks for tuning in today, and thanks for watching.